Welcome to the fifth in a series of the low FODMAP diet treatment videos. And in this one, I'm going to look at the effects on gut health. I want to concentrate initially on an area of confusion. So a lot of people want to know, well, what is the difference between a prebiotic with an E and a probiotic with an O? Well, there's a very simple difference. Probiotics with the O are the actual gut bacteria, whereas the prebiotics with the E are the food for the gut bacteria. Now, FODMAPs have a lot of these prebiotics in them, but research actually indicates that with the exception of one bacteria, which is called bifidobacteria, and I'll go into that in more detail in a minute, the type and number of bacteria in the gut are not actually significantly altered by the low FODMAP diet. So despite the fact that we're removing a lot of prebiotics, it doesn't seem to have a huge effect on other bacteria in the gut. I want to just cover something that we looked at earlier on in an earlier episode, which is the national guidelines for probiotics. So probiotics, the actual bacteria. If you've got IBS, it is advised that you might want to try a 3-month trial of a probiotic. It's important to remember that the positive effects of probiotics actually wear off about 1 to 3 weeks after you stop taking them. So in essence, if they work, it looks like you need to take them long term, and of course that can be very expensive. However, probiotics may be useful if you've had gastroenteritis or taken antibiotics, but the jury's still out on exactly how much probiotics will benefit your IBS symptoms. So looking at the gut health, one of the questions we get asked a lot is, will the low FODMAP diet be bad for my gut bacteria? Well, as I mentioned earlier, it does appear that low FODMAP diet reduces a bacteria called bifidobacteria, but this appears to only be effective in the short term, and no other bacteria seem to be affected by the diet. Recent research suggests that those bifidobacteria actually look as though they return to normal once you start the reintroduction process. But it does emphasize that you really mustn't do the diet for longer than 8 weeks, and that the reintroduction process is absolutely essential. A lot of people would say, well, if bifidobacteria is reduced by the diet, why don't I just take a probiotic with bifidobacteria while I'm on the low FODMAP diet? So I want to finish this section by saying that at the moment, there just simply is not enough evidence to recommend that patients should take a probiotic alongside the low FODMAP diet. But we wait for more research to come out in the future. I hope you found this section useful on gut bacteria.